States Rights Caucus on the Judiciary Committee. We'll now go to the gentleman from Arkansas, Mr. Griffin, for his questions.
Thank you, Mr. Chairman. Excuse me. Dr. Weinstein, I am particularly interested in the Gallup poll that came out in February of 2010. Over the last year or so, I've talked to a lot of doctors in my district who are advocates for some sort of a medical liability reform. And during the last year, this poll came out, and I was struck by the numbers. And I saw that you referenced this Gallup poll in your statement. The first question I have for you is the data in this Gallup poll, the one that came out in February, is it consistent with other data that you've seen, particularly the point that physicians attributed 26% of overall health care cost to the practice of defensive medicine? And then secondly, that 73% of the physicians agreed they had practiced some form of defensive medicine in the past 12 months. So my first question is whether that data in the Gallup poll is consistent with data that you have seen elsewhere.
Mr. Griffin, I think the data on the cost of defensive medicine vary considerably from low estimates of $56 billion over 10 years to this was the largest estimate of $650 billion. And you can go back to studies like Kessler and McClellan and others who've looked at it, and the costs of defensive medicine are astronomical. And physicians practice defensive medicine. It has not going away. You know, a very well done study, not by doctors but by lawyers, this Harvard group showed that 90+% of physicians in the state of Pennsylvania practice defensive medicine. When they surveyed residents, doctors in training across all the residencies in Pennsylvania, they found that 81% felt they couldn't be honest with patients. They viewed every patient as a potential lawsuit. And the most depressing statistic of all was 28% of residents across the spectrum in Pennsylvania regretted their choice of becoming a doctor because of the liability crisis.
With regard to the Pennsylvania data that you're discussing, have you turned that data over to the committee?
Yes, sir. That's in the written testimony, the reference to that.
What procedures, could you give us some specifics on the procedures that are usually subject to the practice of defensive medicine?
Sure. Defensive medicine breaks down into two areas. One is assurance behavior. You need to assure yourself you haven't missed something. As has been pointed out by Dr. Hoven, in medical school you're trained to take a history, do a physical examination, and try and put this puzzle together. Occasionally you'll need one test, a lab test, or an imaging study, and then you'll take it in an orderly progression. But the climate of fear that exists from the medical standpoint is such you need to keep taking that progression, that orderly progression to the very end from the beginning. Because should you miss something, your life and your ability to practice medicine and your craft is over. So that's the assurance behavior. Avoidance behavior is most medical students come out of medical school with, in our school, it's over $100,000 in debt. So when they choose a career, they come out of our orthopedic surgery residency able to take care of anybody who's brought in off the highway, who's had a traumatic injury, and put them together again. But the majority of them don't want to do that. They don't want to cover the emergency room because that's a high-risk environment. So you avoid things that are high risk. You avoid OB. If you're a neurosurgeon, you don't take care of children head injuries. Doctor doesn't do vaginal deliveries or any deliveries at all. So that's how the avoidance behavior affects the American public.
So getting down to the specific medical procedures that are usually subject to that, so you mentioned head injuries, you mentioned OBGYN. Can you get even more specific in terms of the actual procedures?
Well, I think just head injuries in children. There are very few neurosurgeons willing to take care of a head injury in a child. At one time in this town, 40% of OB-GYNs weren't doing deliveries. This was a few years ago. 1 in 7 OB-GYNs no longer deliver babies. OB-GYNs now on an average, get out of obstetrics at age 48, which would be a mid-career point. You're just reaching your peak. You've got another 20 years of practice. But now OB-GYNs stop practicing obstetrics at age 48 because of the liability risk.
if you have a number of tests that are being conducted using equipment and using resources, and in some instances they are not necessary, they are more to assure or to avoid, can you comment on that crowding out tests that need to be conducted that are necessary?
Yeah, I think that when you crowd a system with, I won't say that they're unnecessary tests. The gentleman earlier was sort of implying that these tests are illegal, that you're defrauding Medicare. I think that's not the truth. But basically, as I mentioned, when you progress to solve a puzzle in taking care of a patient, you follow an orderly progression. You know, if this doesn't work, then we'll do this study. We'll do a CT scan or a myelogram or an MRI. But we can't afford to do that anymore. So what happens is you use valuable resources, imaging resources in particular, to do defensive medicine, to take that step number 10 and bring it down to step number 2, and you deprive someone who actually needs that resource from the use of it.
So if a young child who has a head injury comes into the emergency room, in an ideal situation, you're saying a doctor would look at that child and say, well, I'm going to start at step 1, and if I think I need to go to step 2 on my way to 10, then I'll do that progressively. But in the current environment, they see the child and they automatically say, we got to do 1 through 10.
Well, I think if there is a pediatric neurosurgeon or a neurosurgeon willing to take care of that injury at that hospital, because I think 3/4 of our emergency rooms are at risk because of the availability or lack of availability of on-call specialists, that doctor will proceed with the entire battery from step 1.
And not progressively,
and
right.
not necessarily in an orderly, progressive fashion,
Right.
which you learned in medical school.
Sure.
Thank you, Mr. Griffin. Appreciate those questions. The gentleman from Georgia, Mr. John.